I have not received the Harvard acceptance letter yet. I have not walked through those gates yet. I have not sat in those classrooms yet. But I made a decision. I will not wait for Harvard to start thinking at Harvard's level. Day 15 of documenting my rise as a global health and wealth architect. And today I want to be completely transparent with you about something most people building toward a big goal never admit publicly. The goal is still ahead of me. Harvard is still a destination, not yet a reality. And that gap, between where I am now and where I am going, is exactly where the most important work happens. This video is about what I am doing in that gap. Every single day. Why I refuse to wait. Let me tell you something. I had to learn the hard way. Big goals have a dangerous psychological trap built into them. The trap is called waiting. Waiting until you are accepted before you start preparing. Waiting until you arrive before you start thinking. At that level, waiting until the door opens before you build the capacity to walk through it. I refused to fall into that trap. Because here is what I know about Harvard, and about every other room of global consequence. The people who contribute most when they arrive, who ask the sharpest questions, who bring the most original thinking, who make the biggest mark. They did not become those people inside the institution. They became those people in the years of preparation before they ever arrived. The institution did not create their capacity. Their daily habits did. So my question became, what are the daily habits that build Harvard-level thinking in a doctor in Brazil who has not yet been accepted? And the answer I keep coming back to is simple. Read the right books. Wrestle with the right ideas. Build the right frameworks. Every single day, without waiting for permission. 5 books that will change how you see everything. Let me give you the exact books that are reshaping my thinking right now. These are not nice to reads. These are must-reads for every young leader, health professional and institution builder in Africa and Brazil. Book 1. The story of a physician who built health institutions in one of the poorest countries on earth, against every odd, every funding gap, every political obstacle. This book does not inspire. It convicts. It shows you what radical commitment to a community actually costs, and why that cost is worth every sacrifice. Book 2. 2 Nobel Prize-winning economists who spent years living inside poverty, not studying it from a distance, but inside it. What they discovered about why families make the health and financial decisions they make will permanently destroy every assumption you carry about poor communities. This is evidence-based compassion at its most powerful. Book 3. A Harvard surgeon discovers that the single most powerful tool for saving lives in complex medical systems is not a new drug, not a new technology, not a bigger budget. It is a checklist. For someone building health institutions in Africa and Brazil, this book is pure operational gold. Book 4. A Harvard Kennedy School text that draws the most important distinction in all of leadership, the difference between a technical problem that has a known solution, and an adaptive challenge that requires people to fundamentally change how they think and behave. Every single health system problem in Africa and Brazil is an adaptive challenge, not a technical one. This framework changed everything about how I lead. Book 5. The autobiography of a man who spent 27 years in prison and emerged more institutionally minded than when he entered. A masterclass in holding a vision across decades, not just across a 30-day content challenge. For someone documenting a rise to global authority, this book redefines what patience means. The 4 ideas that will make you dangerous in any room. Beyond specific books, here are the 4 ideas that are making me sharper, bolder and more architecturally minded every single day. Idea 1. The social determinants of health. Health is determined more by the conditions in which people are born, grow, live and work, than by the healthcare they actually receive. Read that again. The neighborhood you live in, the school you attended, the income your family earned, the water you drink, the air you breathe. These factors predict your health outcomes more reliably than your doctor ever will. This single idea moved me from thinking like a clinician treating symptoms, to thinking like an architect redesigning conditions. Idea 2. Health system strengthening. Africa has been a laboratory for disease-specific programs for decades. Malaria here, HIV there, each with its own funding, its own staff, its own reporting system. The result? Strong vertical programs sitting on top of weak horizontal foundations. Health system strengthening says, build the foundation first. Build the infrastructure that serves all diseases, all patients, all conditions, permanently. The harder solution, the more durable one. Idea 3. Universal health coverage, not free healthcare for some. Not charity clinics for the deserving poor. Genuine universal access to quality health services for every human being, without financial hardship. This is the architectural standard I am building toward. Everything else is a compromise we accept on the way there. Idea 4. Direct primary care as a structural revolution. The protected, continuous, trust-based doctor-patient relationship is the single most cost-effective health intervention available anywhere in the world. Not a business model, a moral imperative, and the intellectual spine of everything I am building in Africa and Brazil. The most important thing I want you to do after watching this video, do not just watch this video. Do not just save it. Do not just share it. Although please do share it. Do this. Pick one book from this list. Order it today, or find it free online, or download the summary, and start reading it before you go to sleep tonight. Because here is the truth that this entire journey is built on. The quality of the institutions you build in the world will never exceed the quality of the institution you have built inside your mind. Your mind is your first project. Your thinking is your first product. And your intellectual habits, the books you read, the ideas you wrestle with, the frameworks you apply, are the foundation of everything else you will ever create. Harvard accepts students who already think at a high level, and then makes them think even higher. You cannot wait for the acceptance letter to start building your mind. Build it today. Build it on this video. Build it on these books. Build it on these ideas. And watch what happens to the quality of your decisions, your conversations, your content and your institutional impact, in the next 90 days alone. The world does not need more people with impressive degrees and average thinking. It needs more people with extraordinary thinking who then go and get the degrees that give them access to the rooms where extraordinary thinking can change everything. Start with your mind. Everything else follows. If this gave you a reading list and a framework that will change how you think, share it right now with one ambitious young person in your life who is building towards something great. Subscribe so you do not miss a single day of this journey.